Women tend to shoulder the health responsibilities for the entire household, which can lead to them putting their own concerns last. Today, I'm happy to see Dr. Tricia Sellers from United Healthcare Nevada to discuss ways to support women's health, especially when it comes to cancer prevention. Good morning.
Good morning, Jessica.
Well, it's wonderful to have you with us. So why is cancer prevention so important for women in particular as well?
Yes, so women actually, recent claims data has shown they have a 55% higher chance of having any type of cancer as compared to men. And like you just said, women often, every situation is unique, but they often are taking care of the entire household, whether it be children, aging elders, even pets, before they think about their own health prevention.
That is so true. And sort of elaborating a bit on that, are there any health disparities of note?
Unfortunately, yes. So women of color have a higher chance of death from colorectal cancer, and Hispanic women specifically, at time of diagnosis for breast cancer, they tend to be younger, but it's actually more severe disease, unfortunately.
Yeah. You know, talking about those risks and those things that are out there, I mean, what are some steps women can really take to help protect their health?
Yeah, that's a great question. So first of all, as we just mentioned, they're kind of reprioritizing themselves, whether it's just putting it on the calendar, similar to how they might do for a family member, but just being aware. So getting into their primary care provider for a general health screening, but specifically breast cancer, colorectal cancer. For breast cancer, there's 1 in 8. 1 in 8 women will be diagnosed with invasive breast cancer, and 1 in 26 for colorectal cancer. There are annual screenings for breast cancer, around 40, and 45 starts with colorectal cancer screening. So it's good to have a risk assessment first to know what type of test might be right for the person.
Yeah. You know, in thinking about when someone is diagnosed, a lot of times it's not just the person that goes through such a rough journey and difficult process. It's also those loved ones, the partners, those caretakers. So, you know, what are some ways and how can loved ones really support and play that supportive role for someone going through a diagnosis of some kind?
Yeah, that's a great question. Certainly a lot of the stress comes from just a stressful diagnosis and then navigating an unfamiliar system. So certainly UnitedHealthcare.com has some tips for, you know, what preventive services might be covered, what to do if one of them unfortunately comes back negative. There's often case management support to help families navigate.
Yeah. Now, for women who sort of feel overwhelmed, you know, when you go in and let's say you do get a diagnosis and there's all of these emotions and things that you're sort of going through. And I think the biggest question for a lot of women would be, where do I start? What do I do with this? So what is that starting point for someone who discovers that, you know, they may be impacted by a certain diagnosis?
Certainly. Well, you know, it's great for people to have a primary care provider. That can be tricky. Sometimes people have a prior negative experience with the health system, but you know, certainly reaching out to, again, the health plan can help people navigate and find maybe a better fit for them to help them navigate these difficult situations.
Yeah, and you know, I think as well, talking about health coverage, it can also feel a little overwhelming. Sometimes you just don't know what that is or how much it will cover. I mean, where can people find that information with their providers?
Certainly. So UHC.com, UnitedHealthcare.com has a lot of good resources, and likewise, just calling when, you know, we often don't know, many people, what your insurance covers until you need it.
Yes.
And so certainly just picking up the phone, there's a member services number that can be very helpful to address unique circumstances.
Yes. Well, thank you so much for joining us this morning. To make sure you are prioritizing your health and focusing on preventative attention, get in touch with United Healthcare by going to UHC.com.